Good morning to all of those who make this broadcast possible. To Lázaro, to our sign language interpreter, and to everyone tuned in to this briefing. We begin today's press conference with the unfortunate news of the death of an 80-year-old female patient. The patient had been in a critical condition in intensive care for several days, was from the municipality of 10 de Octubre, was hospitalized on August 9th, and tested positive for COVID-19 on the 10th. As I mentioned, the patient was an 80-year-old woman and asymptomatic at the time of testing. She was a confirmed case contact and was therefore immediately admitted to hospital. The patient began to develop symptoms on August 13th and was transferred to the intensive care unit. She spent 15 days in hospital and suffered from a series of complications. Despite the efforts of our specialists, professionals, and technicians, the patient suffered a group of complications and went into cardiorespiratory arrest, from which it was not possible to revive her. We reiterate our condolences to the patient's family and friends. Such news is always unpleasant, and we deeply regret the death of this patient yesterday. Today, 1,010 people are hospitalized in Cuba. 25 are under observation. There are 479 suspected cases and 506 confirmed, active, hospitalized cases. Yesterday, 3,056 samples were processed in our various molecular biology laboratories. 915 were processed at the Pedro Curi Tropical Medicine Institute, 375 in Santiago de Cuba's Hygiene, Epidemiology and Microbiology Center, 217 in Havana's, 98 in Villa Claras, 376 in the Genetic Engineering and Biotechnology Center Lab, 306 in the Naval Hospital, 205 in the Molecular Immunology Center, 176 in the Fructuoso Rodriguez Hospital, 63 in the National Center for Genetics, 114 in the Manuel Fajardo Hospital Lab, and 84 in the Civil Defense Laboratories. Of the 3,056 samples processed, 15 tested positive for SARS-CoV-2 and COVID-19. That's 15 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 372,945, of which 3,759, or 1.01%, have tested positive for the virus. Of the 15 positive cases yesterday, 14 are Cubans, and 1 is a foreign resident in Cuba, and a confirmed case contact. I state this to clarify that this is not an imported case, that the foreign resident in Cuba contracted the virus from a previously confirmed case. 13 Cubans and the 1 foreign resident are all confirmed case contacts. This means that 3,354 people, or 90.7% of all cases diagnosed in Cuba, had contact with someone who had previously tested positive for the virus. Of the 15 cases diagnosed yesterday, the source of infection linked to one is yet to be determined. Of all such cases reported in the last 15 days, the source of infection linked to 7 is still yet to be determined. Yesterday, none of the confirmed cases contracted the virus abroad, meaning that imported cases remain at 335. Of the 15 diagnosed cases yesterday, 8 are male for 50.2% of all cases, while 7 are female, representing 49.7% of all diagnosed cases. 11, or 73.3% of all diagnosed cases yesterday, were asymptomatic at the time of testing, for an overall total of 57.4% of all confirmed cases since the pandemic began in Cuba. Any one of us could have the virus and not know it because we don't have symptoms. And what is worse is that we could infect others, those around us, if we don't protect ourselves and if they don't protect themselves. That's how the virus spreads. By age group, one positive case diagnosed yesterday is under the age of 20, for a total of 391 minors, or pediatric patients. That's patients under 18 years of age. Of the 391 children who have tested positive for the virus, and who, I would like to point out, despite responding well to treatment, can still develop complications, 355, or 91%, have been discharged from hospital and made a full recovery. Yesterday, 6 people between 20 and 40 years of age tested positive for the virus. 5 are between 41 and 60, and 3 are over the age of 60. Of the 15 positive cases yesterday, 11 belong to Havana, 3 to Artemisa, and 1 to Villa Clara. Of the 3 cases from Artemisa, 2 belong to the municipality of San Cristobal and 1 from Mariel. The patient from Villa Clara is from the municipality of Manicaragua. Regarding Havana, of the 11 cases belonging to the province, 5 are from Arroyo Naranjo, 2 are from Boyeros, 2 from Habana Vieja, 1 from Regla, and 1 from the municipality of Plaza de la Revolución. Of the 15 positive cases yesterday, 8 had already been admitted to hospital, and 7 were in isolation centers. Why? Well, every time someone tests positive for the virus, everyone they have come into contact with is sent to an isolation center for a certain period of time, where they are also tested for the virus. Sometimes a confirmed case contact is an elderly person or a person suffering from pre-existing medical conditions, in which case they are immediately admitted to hospital. They might also be a suspected case with symptoms of the virus, in which case they are also admitted to hospital. This means that we are able to prevent confirmed case contacts who, as we know, are also highly likely to have contracted the virus or have symptoms of it, from spreading the infection by isolating and treating them. Yesterday's results therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 23.46. Artemisa follows with a rate of 13.29, both slightly lower than yesterday's figures. Then Pinar del Rio with 5.65, Villa Clara with 1.93, Matanzas with 1.81, Las Tunas with 0.56, and Mayabeque with 0.52. This means that Cuba's rate over the last 15 days stands at 5.68 per 100,000 inhabitants. When we look at this figure since the pandemic began on March 11th, it stands at 31.7 per 100,000 inhabitants. To summarize, of the 3,759 people who have been diagnosed with the virus thus far in Cuba, 506 are active hospitalized cases. 490, or 97%, are clinically stable. The one fatality that occurred yesterday brings Cuba's COVID-19 death toll to 92. This means that the island has a mortality rate of 2.44%, while the global rate stands at 3.44% and the regional rate at 3.54%. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, a good number of people were discharged from hospital, 57 in total, 51 from Havana and 6 from Artemisa. This means that to date, 3,159 people, or 84% of all confirmed cases in Cuba, have recovered from the virus. Today, 3 patients continue to be in a critical state, with 13 reported as serious, all of whom are from Havana and being treated in intensive care. Yesterday, unfortunately, one of the serious patients passed to critical. 2 more patients joined those in a serious condition, and 1 serious patient passed to closely monitored. This is the COVID-19 situation in Cuba, which has become increasingly complicated over recent weeks and concentrated above all in the west of the island. However, with the measures that are being taken and participation of the community, we should be able to resolve this situation as quickly as possible. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 232,321 people were diagnosed with the virus, for a total of 23,673,902 confirmed cases since the start of the pandemic. At this rate, we'll reach 24 million by tomorrow. Yesterday, 4,522 people died of the virus, for a total of 813,944 COVID-19 fatalities and a mortality rate of 3.44%. The region of the Americas, epicenter of the pandemic for several weeks now, accounts for 53.45% of all COVID-19 cases worldwide. That's practically 54%. Yesterday, 29,284 new cases were reported in the region, for a total of 12,652,851 confirmed cases. 2,606 deaths were reported in the region yesterday, bringing the COVID-19 death toll in the Americas to 447,538 and a mortality rate of 3.54%. Just like yesterday, the United States continues to top the list of countries hardest hit by the pandemic, with 5,749,909 positive cases. Next comes Brazil with 3,622,861 and India with 3,177,323 COVID-19 cases. Then there's Peru, Mexico and Colombia in 6th, 7th and 8th place on the list of countries with the highest confirmed case and fatality rates. This is the information that we have on the behavior of the pandemic in Cuba and the world.